So it's a real pleasure to welcome our panel today, and I'm joined by Chief Clinical Officer Colm Henry. Colm, you're very welcome. By Lorraine Schwamberg. Lorraine is the Assistant National Director for QPS Incident Management. Catherine Hogan, who is QPS Incident Management team member and has been lead for the project we're going to hear about today. Flavian Pluzinak, who is a colleague from HSE Digital, and Flavian is going to show us how this system works. Dr. Marie Ward, my friend and colleague, who's working in St. James's Hospital now. Marie's a PhD in human factors and is working with the Health Systems and Research Learning facility in St. James's Hospital. And a special welcome to Tibbs Pereira from Patients for Patient Safety Ireland. Tibbs is a co-founder and is chair of Patients for Patient Safety Ireland. So you're very welcome, Tibbs, today, and to all our panel. And what we're going to have is really an overview now of the patient safety alert system. And so I'm going to hand over to Dr. Colm Henry in a moment, who will give you an introduction to the work, and then Catherine Hogan is going to tell us a little bit about the background and explain some of the features of the system. Flavian is going to give us a live demo of the system, and then we'll have a panel discussion. It's important to say this is a first glimpse of this system today, and I think we're keen to share what work has been going on, but also to invite people to participate in the further shaping of the system. And so that's one of the things we'll be asking you today is to share the fact that this is going on, and maybe to encourage and invite other people to come in. Colm, I might just hand over to you if that's okay. And
yeah, thanks, John, and thanks for that introduction. And I'm really delighted to join the QPS talk time. We still are in quite volatile times, a lot of uncertainty around us, both from the point of view of COVID-19 and also with the departure of many significant people in healthcare and the Department of Health and here in the HSE. So it's all the more reason in these uncertain times that we should continue and nurture and allow meetings such as this to flourish, because that's if they become the first casualty of uncertain times, then we won't be able to recover as effectively as we need to, and we have huge challenges ahead. We are aware that at the end of June we're still seeing surges of hospitalization we would only see in the middle of winter, attributed to recent variants in COVID-19. We have huge challenges in scheduled care. We have individual challenges through learning in mental health and CAMS. There's no shortage of challenges facing us today, and opportunities such as this and taking time out such as this is absolutely critical. It shouldn't be the first casualty of uncertain times, and it shouldn't make room just because we're too busy. So I welcome all the 200+ people who are registering today, and thank John and his team for facilitating this. So just next slide, please. I'm delighted to introduce or offer a first glimpse, as John puts it, of a patient safety learning, sharing and improving together, an online resource that allowing us to share information. For those of you of my vintage, we know that all too often our ability to share and pool learning either came from individual failing or learning from that of your friends, or from the MPS casebook in the case of doctors, all too sporadic and not very systematic, and also perhaps focused all too often on things that go wrong, and perhaps promoting a more defensive mindset in all of us when you view things that way. And what the beauty of this resource, it will allow us to pool collective learning, to learn from other people's experience, and to learn what works without necessarily having to wait for our own career trajectory to meet whatever experience other people have had. So what is it? It's a free available online resource enabling all healthcare staff to access and download new and up-to-date patient safety information. As I said, it allows a huge pooling of corporate memory and experience, of frontline memory experience, instead of us all undergoing our own individual and sometimes isolated journeys as healthcare professionals, learning as we go. Next slide, please. Purpose is to support staff. So first and foremost, to support all of you in identifying and applying relevant learning for QPS at all levels. And shared learning allows us to close the loop on incident reviews and reporting. And of course, it supports patients and service users also in accessing QPS information and up-to-date information for them as they navigate their own way through the Irish healthcare system, which is not always easy. And the collective aim of staff and patients and service users is, of course, to prevent similar incidents or negative experiences that other people may have had happening again, so we can all learn not just from our own errors or mistakes or those of our friends or fellow professionals, but of the wider healthcare family. And through that, those many ripples, we build a culture, a wave, if you like, a culture that enables staff to report safety incidents without fear in the true spirit in which they should be reporting them. That is to not just to be open and to be disclose to patients what's going on, but also to continuously strive to improve our healthcare systems so that such events either will never happen again or we reduce the chance of them happening again. Next slide, please. As part of this is a new patient safety alert working group. A key aspect of this is to funnel all this learning through these national patient safety alerts, and the working group has been established to put order and discipline to this. And it's a multidisciplinary working group with much membership. And I'd like to announce today Darren McLaughlin, consultant in ED medicine in the Cork University Hospital and the Mercy Hospital, which you notice hanging in the wall here in Dublin, has been appointed as chair. So I might just go over to Darren for a second to allow him to introduce himself.
Thanks very much, Colm, and thank you, John. Delighted to be working with all the team in QPS, and we'll be working on the National Patient Safety Alert system. So there's lots of work going on. Thanks very much.
You're welcome, Darren. Thank you again. To look at the project collaborators, it feeds through my own office, through the QPS, to acknowledge Orla's work, and Lorraine Schwanberg is on the call here. Big role for patient representatives, Patients for Patient Safety Ireland, and the HSE's National Patient User Forum, HSE Digital, the Forum and Postgraduate Training Bodies, of course, National Patient Safety Office and Department of Health, with whom we work closely, the State Claims Agency, my own clinical forum, Mental Health Commission, HICWA, and HSE colleagues right across the delivery system, ambulance service, acutes, and community. Next slide, please. So thanks to everybody who's turning up today. We need enthusiasm. We need to build a movement here. This is something that facilitates the movement. It's not an end in itself. The working group chaired by Darren is again facilitating this. What we need to do is facilitate a change in culture and mindset so that we continue to build on the work, the hard work that's been done through some difficult times in the past few years, to build a culture of openness, acknowledgement of recording patient safety with a view to continuously improving the services and continuously improves the care we give to patients. And I just want to thank everybody who's been involved. So thank you, John. I'll hand back to you.
Thanks, Colm. That's great, and thank you for giving us, I suppose, reasons why this is so important, you know, and why we need to be doing this work, and acknowledging that it takes time, and that it's good to be here doing this. I'm going to hand over now to my colleague Catherine Hogan. Catherine's going to tell us a little bit about the background of this particular system and then kind of the project itself. And then she's going to really hand over to Flavian, who I hope will be able to give us a demonstration if that's possible. If not, we're just going to talk about the system. Catherine.
Thanks, John. So the aim of today's session really is twofold. So firstly, we're going to introduce the new online resource, which is Patient Safety, Learning, Sharing and Improving Together. And also we'd like to identify potential end users to assist us in testing the system over the summer with a view for further improvement. And we'll give you more details on how to sign up to become a tester later on in the session. So why was this new approach developed then? So there are numerous examples of how Irish healthcare currently share patient safety learning to date, and Colm has gone through a few of them that would have been used in the past. Also, we have existing patient safety alerts, such as the medical device alert that comes out via the Health Products Regulatory Authority. There are morbidity and mortality meetings held across all hospital sites. We have really good examples of local QPS days and QPS conferences. So this project really is going to build on that good work that has been already undertaken, but will also identify new opportunities to inform patient safety learning, such as developing a standardised and easily accessible approach to sharing QPS learning within Irish healthcare. rather than depending on services or sometimes even individuals within services to have to constantly scan the horizon to look for information that might be relevant to them. And also then this new resource will help support and close the loop on incident reporting by sharing learning to help prevent recurrence and occurrence of incidents. So it's a really important part of it. There are many national and international guidelines, policies and academic papers that would recommend and indeed stress the importance of learning at individual level, local level and organisational level. And similarly, this resource and this project is grounded in the learning ambition that is to the fore in these three key documents. So it's the national standards for the conduct of reviews of patient safety incidents from HIQA and the Mental Health Commission in 2017, the Incident Management Framework of 2020 and the Patient Safety Strategy from 2014 to 2024. And then we took the following steps when we were scoping the project at the start. We initially undertook a literature review. We then looked at examples of national learning systems and how organisations such as ourselves in the HSC, HIQA, State Claims Agency, the National Patient Safety Office, how they shared learning within their own environment. And then we also took a review of a purposeful sample of English-speaking countries in the world, and we linked with colleagues in patient partner champions in Canada. We linked with colleagues in NHS England and Wales, with the Health Safety and Quality Commission in New Zealand, and also with Health Improvement Scotland. And we looked at these countries in the context of how they identify, develop and disseminate learning, particularly following patient safety incidents. And I suppose the team would like to acknowledge and thank our colleagues overseas for the support, the very generous support and help they would have given us along the way. And then finally, working collaboratively and partnering with numerous stakeholders, both within the HSC and within the wider HSC, or say wider healthcare community, and those that were outlined by Colm a few slides ago, has been a really, really important aspect of the work from the start in co-designing this project. So the aim of the project is to develop a multimodal approach to sharing learning. So really a two-way system, learning in and learning out. So learning directly from patients, service users and staff through patient and staff stories and through the development of a quality and patient safety community. Also learning from incidents, research and data through the form of new patient safety alerts, patient safety supplements, and also signposting to other QPS resources such as academic papers, conferences, etc. And all these resources then will be shared within the new NQPSD website via a dedicated open access webpage, which is being called Patient Safety, Learning, Sharing and Improving Together. And we'd like to acknowledge the group here today in helping us come to that name as well, because I know a survey was sent out to this community, and thank you all who contributed to that. So there will be a number of offerings available initially, but this is very much going to be an agile approach to evaluating both user journeys and any feedback that we receive will inform the site, and the site will be responsive and evolve to meet user needs as it's going along. So initially we will have a number of offerings, and foremost are these patient safety alerts that Darren will chair the group to support those. So patient safety alerts, they're going to be high priority communications in relation to patient safety issues, which requires HSC services and HSC funded agencies to take specific actions within an agreed time frame in order to reduce the risk of occurrence or recurrence of patient safety incidents that have the potential to cause harm. And these patient safety alerts are going to be issued by the HSC, but they're going to be issued in conjunction with key stakeholders such as subject matter experts, our patient representatives, and also clinical and academic experts. Just to bring your attention to the graphic here on the screen, so this depicts the working prototype of the patient safety alert template that's been developed by one of the project work streams and has also been evaluated by a number of end users. And the content on this alert, which maybe we might have seen in more detail on the live demo, contains the content of an alert or a communication that was issued last year. So the second offering is going to be patient safety supplements, and apologies. So patient safety alerts then will be disseminated in two ways. First of all, they're going to be freely available through this patient safety resource on the QPST website, where we will have a searchable repository of all issued alerts, and they'll be available there. But secondly, they're also going to be disseminated through a new channel on a new QPS channel on the existing HSE e-alert system, which is a closed loop system that's already in place that will send out an alert to a designated person for each service, and that allows that person then to review the alert, see what actions are required, determine how and if it applies to the service they work in, and also then to record completion of any action that was required. So as I mentioned, we have developed a new channel on this system, the QPS channel, and we will be sending out requests through the services to identify designated people for individual services, and they will be set up on the new system soon for that QPS alerts. So the second offering then are going to be patient safety supplements. So these will inform HSE and HSE funded agencies of timely and relevant quality and patient safety information for learning purposes. So the difference between the safety supplement and the safety alert is that no action will be required from a safety supplement. It has been communicated for learning purposes only. Content will be identified from several patient safety intelligence sources, such as the analysis of incident reporting, reports from frontline services, or new international or national research and evidence. So just note that the content used on the graphic here may not be accurate. It has just been drafted up for testing purposes only. But again, the prototype is in play at the moment. Thirdly, then we will have safety stories, and safety stories aim to give a voice to patients, service users and staff who have been involved in or impacted by patient safety incidents in the first instance. So storytelling has been shown to be effective in creating a dialogue to both increase safety awareness and assist in connecting knowledge to action. We do have a number of stories and videos already available on the NQPST website, but we will be linking with patient groups, patients and staff this year also to develop a number of new videos towards the end of the year, which is great. So we know that there are international communities such as Healthcare Improvement Scotland, where there are dedicated forums of QPS staff who work together and learn from and support each other. So what we're doing now is looking to see whether there is a want and a need for a similar structure here in Ireland. We're working with a project workstream to establish a special interest group through the Q Community platform to see would that serve its purpose. Is there an appetite for such a forum, and would it be valuable and both a sustainable offering? So again, that is something that is being worked on at the moment. And then finally, the last offering on the new resource will be a section for further learning, where we will be signposting to QPS resources such as conferences, academic learning, surveillance data and resources. So that's a very, very quick run through of how we got to here and what will be contained within the resource. I'm going to pass you over to Flavian. I'm not sure what I'm passing you to Flavian for. Unfortunately, we thought we would have the opportunity for a live demo now, but Flavian, maybe you'll be able to talk us through the content today.
Yes, I'm very sorry. Thanks, Catherine. Very sorry for the anticlimax here, but we have an issue with our testing environment, so I won't be able to demo the system now. But what I can do is, as quick as possible after this event, I can share people a link to a video recording that showed most of the screens. And if you, I will ask for the emails of all the participants, and I will share the link. And going with that link, once you have seen the demo or the video, you can help us by providing your feedback. So the link to a survey as well, and you can tell us your thoughts and what you like. Think there are any things you think we should improve. So apologize again for not being able to run this live demo, but I will share the demo by email after this event.
Flavian, what were we expecting to see, or what were you expecting to show us today, just in terms of the features of the system?
So where we are at the moment is that we have a landing page where you could find the different types of of content that Catherine has described. So you land on a page and you see all the latest stories and so on, and events, and you will be able to filter in and find the stories you're interested in and read the details of each piece of content.
Yeah, and obviously we've been, a lot of the work we've been doing on this is to try and make it the user experience here as good as possible, and I think we're trying to encourage people to come forward to help us with that and to participate in that.
Exactly. So that would be the second big block of work. So at the moment, it's mostly about publication and making it as easy to find as possible, make the content engaging and easy to understand. But obviously the next stage is to use this sharing hub where the people can access to this very important information and will be invited to contribute and share their own content.
Okay, great. Well, look, we look forward to being able to get a demo whenever the system is ready for it. And I think obviously this is just, it's work in progress. So thanks for that. I might just ask Catherine, do you have anything to add, Catherine, to that, just in terms of the user experience and what people can expect to see on the website when it goes live?
Yeah, so the hope will be, John, and that's what Flavian and his team are working at the moment, that will be very easy to navigate through. So it will be searchable through Google. You can go in through the HSC website. It'll be a page within our own NQPSD website. You will get to that landing page where it's very clear that this is a section on alerts, this is a section on supplements, this is a section on stories, and you will see the most recent content on that landing page. And then you will then can click in, say for patient safety alerts, you can click into that section, and then it will list all the alerts that have been issued. Now, I suppose it is a work in progress, so the content is going to be built from scratch for this resource as well. So for the initial while there won't be a huge amount of content there, so when you're searchable, there'll only be a small number of alerts there. But as the years build on, we can do, you can be able to search through years, you'll be able to search through keywords. So if you're coming in from a discipline such as anesthesiology, you could search under your keyword. You could also search to see how many alerts were issued to the service in 2022. So it will be very kind of user friendly that way. As I said earlier, and I think you mentioned it as well, John, it is going to be very agile and iterative. So again, it will very much respond to, and it is new software that has been brought in through HSC Digital. It's called Wagtail, for those among us that know what that means. I don't know it. I can see a question from Cara, and Cara is also one of our patient reps on our steering group and a great ally and supporter of it. So it is going to be freely accessible, Cara, so it'll be open access. So it'll be anybody at all, once they have website access, will be able to get onto this web page. Again, testing over the summer, and it's a really key thing. If you're interested in testing, we'd love you to become involved. We'd love you to get onto that link that we'll be sharing later, just to make this better and to make sure it's serving the needs of people, that the end users really. And we have been involving end users as much as from the start to make sure that it addresses those needs. The website will look a little bit different to the current HSC website, and I think that's an evolving process. So and a big, I suppose, focus on this technology on this website is to make it very mobile friendly. So a lot of us are accessing these resources from our mobile now. So some of the old design, you know yourself, when you're going through your mobile and trying to click boxes and everything isn't on screen. So that's a big focus, that we're going to try and make it as accessible as possible. But again, it's starting from scratch. So it will be building up the resources, but it will be responding to users' needs. So if you have feedback at all, we'd really appreciate if you could let us know.
Great. So I think that's a key ask for today is just, for people, when the links do become available, get on, have a look at it, and that, we want to listen and hear kind of what that experience people have and the ideas that they have, because we want to make this both useful and usable. So thanks, Catherine. I might call our panel together if that's okay, and so I'd like to welcome back there Colm, and also welcome in Lorraine Schwanberg and Marie Ward and Tibbs Pereira from Patients for Patient Safety Ireland. you know, Colin, I might start with yourself if that's okay. You know, the patient safety strategy, one of the commitments is using information to improve patient safety. And I think we've heard a lot about how we get that information out there and the importance of you know, getting that out in the right way. But what makes for good learning and good information for learning?
Well, good question, John. I think anyone who's worked in the front line will know there's nothing more painful than learning from your own experience. Being involved in an adverse event, it's a very painful experience. Obviously, the primary victim, of course, is the patient to whom harm was done. We all know, but the secondary harm that's done to people who are involved with this, it's and we all see the way that influences behaviours. We've all worked with mentors before, people, consultants and others who are senior to us, and we see how adverse events have shaped their own behavior and sometimes shaped a kind of defensive mentality. So that learning is good, but it's somewhat limited. And I think the beauty of what's been proposed here, what's been introduced here, is to pool that kind of collective learning. So that we can see view our own experiences in a wider context, and not inflate them beyond what they may be in our own heads, and let that influence the rest of our careers and how we interact with patients in a way that actually might lead to further harm through defensive medicine, for example, but also to allow a greater and more real-time sharing of real information and those alerts. So as I say, John, nothing more painful than learning yourself, but that's not enough.
Yeah, thanks, Colin. And I think I think everybody in this field has experienced that. And I suppose, you know, the idea of you know, things can happen many times before learning happens, and hopefully, you know, things like this will certainly accelerate that process. Lorraine, I was very impressed with, you know, when Catherine was talking about this, you know, the work that was done looking at other systems around the world. And what's your experience of this been from other places?
Yeah, I mean, definitely. Obviously, I've had experience working in the UK for a number of years and that, but when I joined the HSE and got involved with this project, a good bit of work had already been undertaken, and what I really liked was how they really interrogated other jurisdictions and learned from them, and already did that collaborative piece as to what worked well with them. So we know that in Scotland, for example, the safety community works very well in terms of shared learning. We know that in the UK, the National Patient Safety Alert System works very well and is particularly strong. And it's something that we want to continue to nurture, to have those collaborative pieces of work with international partners that will inform this project going forward also.
And how do you see this changing over time and developing?
I think colleagues touched on it. I mean, it's really important that we get that user engagement.
Yes.
It is intended to be modeled on user experiences. We want the resources to be user friendly. So Catherine touched on the safety supplements that we will be developing with subject matter experts. But alongside that, we want pieces like just a one pager that maybe staff can take to safety huddles, ward meetings. We want to continue to develop the resources as well. I know we've touched on incident management quite a bit, and I think that's where its origin lay. But we want to also take learning from other sources, be that patient experience, coronial processes, and that, to really have a rich resource in terms of the learning that we will share with colleagues. But key for us really is that users out in the system will engage with it. So as Catherine already highlighted, please do get involved and come back to us with any recommendations. I think the piece around the safety alerts can't happen soon enough. For example, we're already working on some examples of content for safety alerts around safety issues that individuals have flagged to us, where we've done a little bit of extra research on that. So it's really a big, important piece of work for us at a national level to develop this piece.
Great. So really kind of this is the start of something, isn't it? I mean, and a way of kind of broadening that information sharing to really kind of meet all the needs. Thanks, Lorraine. Marie, you've been involved in the project as well, and from a human factors point of view, how do you see human factors as contributing to the alert system?
Yeah, thank you, John. I suppose at its heart, human factors is about human well-being, you know, within these very complex systems. And that means our well-being as staff, but also obviously our patients. So I think Colin put it beautifully. I mean, nobody wants to come to work and do harm, you know, so we have to really find out ways and to improve how we learn about, you know, not just things that have happened in terms of the alerts where we have a known event, but also all the near misses that we encounter on a daily basis. And that's where the culture piece comes in. It's so important that we have psychological safety and people feel able to share, you know, look, this nearly happened to me. And I think that's the beauty of this system, is that we have, you know, the shared stories, and that's what connects us as people. And I think that piece, once that starts growing and developing and becoming richer, it will be a real resource.
Yeah, and I think there's so many things in there in terms of the systems of patient safety, and you know, the information has to fit in with how teams work and safety culture and all these things. But the information is critical, isn't it?
Yeah, yeah. And then once we start building this, you know, rich repository, and we know reporting rates are very low, and once we start, you know, building rich repositories, then we can really crack the design issue and get to the kind of human factors pinnacle, which is how do we design systems where, you know, we just can't make mistakes. You know, it's the forcing functions that we can't make mistakes, or if we do make mistakes, then we don't harm, you know, the harm is averted. So that's where we need to get to. Yeah.
Great, thanks, Marie.
Thank you, John.
And Tibbs, you know, from the patient's point of view, it was interesting. You know, it's nice to hear, of course, that this is going to be an open system that everybody can access. But from the patient's point of view, do you think this is going to help?
Hi, John. Firstly, thank you for including me on the panel. You know,
You're welcome.
as a member of Patients for Patient Safety Ireland, you know, and being a patient safety advocate, there are countless benefits, as you've covered in previous QPS talk times. There are countless benefits to having empowered and literate parents, patients with a strong voice. You know, and that's something that we've advocated for, and we work in close collaboration with the HSE and other parts of the health system in Ireland. So, you know, until this, you know, there are actually three aspects of this resource that I think are really helpful for patients and their families in relation to patient safety. Firstly, patient stories are very useful to the whole learning process in terms of learning and improving safety, and it complements very much the insights from data. So I think, you know, this resource, learning a lot from stories is going to make a big difference. Secondly, I think really importantly, the content and all the learnings are going to be publicly available. So everybody, whether patient, carer, advocacy group, or anyone who is interested, can access really good patient safety information from Ireland that is completely up to date and relevant. And thirdly, you know, a lot of the time, you know, we hear of big ambitious platforms and systems that are put in place, you know, they're at huge cost, and, you know, a lot of work goes into them. But they don't succeed due to a lack of adoption. You know, and this is understandable, particularly in a healthcare environment, because, you know, when you're talking about such a critical organization, you know, there's a lot of things happening, you know, as people are rushing around, and we all understand that. I think, you know, with things like the patient safety alert and patient supplements being pushed out, you know, everyone has access to vital information that will help to improve patient safety. And finally, until now, you know, for a group like Patients for Patient Safety Ireland, you know, the only way we have access to information when we're trying to collaborate with the HSE is the only way we have access to information is through email. So having access to a resource like this is kind of an invaluable source of information, especially as more and more patients and healthcare professionals start to use it. It's an important signal to patients and to families that that the health service is transparent and really wishes to involve patients and their families.
Thanks, Tibbs. Thanks. You know, one of the things that strikes me about this project is I suppose the degree of collaboration that is happening. And what are your thoughts on that? I mean, there are so many I suppose, participants within this that are all offering different perspectives. I would see that as being a strength, even if it makes the process a little slower. I think we end up with a better outcome. What do you think?
Yeah, I agree completely, John. I think, the more diversity there is in anything, particularly when it comes to co-design and co-production, the stronger and better the system. For a lot of us at Patients for Patient Safety Ireland, it's been quite a common experience in the past that we are invited to engage in something and we suddenly get plonked into a meeting room or into an online meeting, surrounded by, big brain, really important consultants and people like that. And we don't really know what's going on. It takes like 2 or 3 meetings before we can actually tune in and decide what our role is going to be. In this case, it's been completely different. The project team, Catherine, Orla, Lorraine, and Ben Cloney, they were all committed to this co-production piece. So, we were briefed in advance, and Catherine and the team really listened to any of the questions, no matter how silly, and answered all our questions really patiently. And so, it did feel right from the start that the group was really inclusive. And that's been the attitude of everyone right since the start. So, it really felt that our opinion and our input and our feedback was really valued.
Thanks, Tibbs. And it's really good to hear that. And I'm going to maybe reflect that question on to Lorraine and Colm. I mean, about the importance of co-production, co-design, co-creation. And I suppose the trickiness of it, in one sense, in that it means we need to take the time, but it's like, I think one of the army sayings is you got to go slow to go fast, because the benefit of doing it this way really pays off in the long term. Lorraine, any thoughts on that?
Yeah, and I know Colm listed all the different stakeholders who've helped us with this project, and they've really inputted, attended all the meetings, really rich feedback, be it from the name of the project to the detail of each work stream. It has been really a big success story, and I mean, it just shows how interested people are, and how everybody is kind of seeking this resource, which will hopefully ensure that it will be a success story down the line as well.
And do you need to secure more time when you have these kind of approaches, or ask people to be more patient, that it's just going to take a bit longer because we're going to do it right?
Yeah, look, I mean, we've had a few challenges along the journey, as I think anybody in the health service had over the last couple of years. But I think over the last little while, the momentum has been there, and every month we see significant progress in the work. Now, we do want to get it right, of course.
Sure.
Hence the multiple strands to the testing, and that in particularly from the ICT side of things. So a work in progress, but we're very confident that we'll have it up and running by the end of the summer.
Great, thanks. And Colm, your thoughts? I think in quality improvement now, the term co-production has really just become, synonymous with good quality improvement. And I think, it's nice to see this as an example of the HSE doing that.
Yes, I couldn't put it better than the way you put it yourself. Go slow to go fast, and of course, the co-production goes beyond this to also how services are designed, and we see an evolving, if belated, recognition on behalf of those clinical leaders who right across our system here and internationally, that designing healthcare systems and pathways around the needs of patients and not around the needs of healthcare professionals is clearly more sustainable and clearly closer to the whole point of healthcare services, which is to deliver better outcomes for patients.
Great, thanks, Colm. And Marie, if I can just ask you another question, just in terms of you're working obviously in a frontline service in a hospital. How do you see this information coming from through the website, through the program, and into practice? How do you see this information being used?
Yeah, it was one of the considerations we had to take was, that busy frontline staff are hopefully going to read the alerts. So I think each organisation, each area will have a designated person, as Catherine said, whose role it will be to disseminate. But hopefully it's a you know, it's a two-way process as well, and you know, and that people from here will contribute their stories and as well. And I think that process should be as easy as the first part. You know, it should be made as easy to share our stories as it is to receive the alerts, and I think that'll be key to it also.
Great, super. Thanks, Marie. Well, folks, I'm going to thank you all very much, and thank you for participating with us this afternoon. I really look forward to seeing the system, you know, when we can access it, and again to appeal to everybody online to, you know, to look out for the opportunity to input into this and to share it with friends and colleagues. I think that's going to be really important. It's not just the people who are here today. We want you to share that. Lots of nice commentary again on what makes good learning, and I think you know, I think data and stories. So lots of people talking about reporting and information and conversations, you know, and the importance of socializing information and getting the chance to talk about it. And I think communication, the importance of communication, storytelling featuring there. I'm going to thank you all, and we're just going to wrap up the session then, if that's okay. So yeah, I have a quick call out again to thank Tibbs for being here today. But on behalf of Tibbs, and he may want to say a word as well, we really want to encourage Patients for Patient Safety Ireland membership. So it's a great organisation, and I think to encourage people to check it out. So again, maybe for the people who are online today, to share the links here to encourage people to go and find out what it means to join Patients for Patient Safety Ireland. Tibbs, would you like to say anything there about that?
Yes, I actually, John, just to go right to the start, I'm not the chair of Patients for Patient Safety Ireland. Cara Madden is, who's also on the call. But that was kind of in the past. You've got a long memory. Yeah, so you know we're part of a World Health Organization program. So you know, Patients for Patient Safety Ireland, you know, works to a lot of the definitions and the goals and the approach defined by the World Health Organization program called Patients for Patient Safety, and so you know we're really fortunate in Ireland. You know, the health service across the board is very inclusive and does engage us a lot, and we're actually all quite busy. We're all working on a voluntary basis, so we do need some more members because there's a lot to be done, and you know we enjoy doing that. So yeah, you know, it's more if you know of patients or anyone who has had good experience of the health service and maybe has ideas that might help to improve patient safety